Marawa, good morning. I'm going to share my screen to welcome you all. So again, good morning from Arizona. I want to welcome you to the Incarceration and COVID-19 workshop, a time to discuss practice and research approaches to combat COVID-19 in correctional settings. My name is Ricky Camplain, and I'm an assistant professor here at Northern Arizona University's Department of Health Sciences and Center for Health Equity Research. And I lead the Criminal Justice and Health Equity Initiative here at NAU CHER. I will be moderating today's workshop with the help of my, I would say, amazing colleague and sister, Carly Camplain. Can you come introduce yourself, Carly?
Hi, everybody. My name is Carly Camplain. I'm a research coordinator senior at the Center for Health Equity Research, and I am currently also a PhD candidate in NAU's Interdisciplinary Health PhD program. And I'm fortunate enough, again, to be here with my sister and colleague to moderate this awesome workshop.
All right. I do really want to start by with an acknowledgement and a thank you to the Arizona Biomedical Research Center and the Center for Health Equity Research for making this workshop possible. I especially want to thank John Garcia, Robert Trotter, and Steve Palmer for being amazing leaders and moving these important health equity topics discussed in this workshop series forward. I would be remiss if I didn't give a huge thank you to our amazing CHER team who do all the hard work. We actually get to do the fun stuff. So Taylor Lane, Marcel Coder, and Nicholas Beckett, thank you for everything that you've done and that you do. And thank you to Aaron from AV Monkey. He's going to keep our workshop going smoothly. And finally, I really want to thank all of you for coming. And for those of you watching the recording down the line, thank you for joining us in the future. I am so excited to have these incredible speakers today. I mean, I can't even express the excitement. We have an unbelievable group representing research and practice for correctional perspectives, national, local, and tribal viewpoints, and just an all-around cool group of people. So we have Megan Peterson and Catherine Watney representing the COVID Prison Project and that national perspective. We have Dr. Dolores Gray Eyes, who's the director of the Navajo Department of Corrections, Captain Richard Martin and Bea Thayer from Yavapai County Sheriff's Office, and Commander Matt Figueroa from the Coconino County Sheriff's Office. And I'll do a better introduction of everyone before presentations and panels. But I do really quickly want to acknowledge that we are missing one perspective today, and that is a perspective of those who have lived experiences in the jail or prison during that COVID-19 pandemic, which is still going on. So to orient you to our workshop today, we will have 3 30-minute presentations on how COVID-19 has impacted incarceration from that national, local, and tribal perspective. After those presentations, we will have a 20-minute break, and I'm crossing my fingers you'll all come back for our panel and have an open discussion with all of our presenters and panelists. I do have a couple of housekeeping things. During presentations, we will have the chat turned off, but we'll turn it back on for people to ask questions through the chat feature if there's time at the end of presentations and during the panel. The chat will also, and again, it'll be open during the panel, but so please feel free to ask questions. This is a great opportunity to learn. But before we really dive into those presentations, I want to kind of make sure we're all on the same page. Some of this is probably well known to a lot of you, but I, again, want to give us a little bit of a background. So more than 20 million Americans have been or are currently incarcerated, and there's about 9 million people who cycle through correctional facilities each year. And at any given time, almost 2 million are incarcerated. So according to the Prison Policy Initiative, more than half are in state prisons, so of that 1.9 million. So over 500,000 are in local jails, as you can see in that orange pie. And with a smaller percentage of individuals confined to federal facilities, juvenile detention facilities, ICE or immigration detention centers, and Indian country and military prisons, as you can see on this side. So we have people from, over almost 2 million people housed in very different correctional facilities. And I have to say, I absolutely refuse to take anyone's thunder during this presentation, but there are a few things to highlight about incarceration during the pandemic. So US prison and jail populations did fall to a historic low during the pandemic. Prison populations fell about 16%, and to give everyone an idea, prisons are those longer term facilities where they're generally run by state or federal or private entities that usually house people for more than a year or more. I want to say that 10% fewer people were released from prison during 2020 than in 2019, and there actually may have been even less released in 2021. This means that reduction, that historic reduction, was mostly due to reductions in admission, not people leaving the prison. So a hypothesis is that reduction was influenced by courts and other parts of the criminal justice system being on hold during that pandemic. Jail populations also fell during the pandemic. Jails are usually run at local, like city or county levels, and tend to be considered shorter term facilities. And again, now that the pandemic is slowing down, jail populations are returning to a pre-pandemic levels. And they're actually saying that many jails have higher populations than before the COVID-19 pandemic. So as a whole, the reduction in incarcerations are probably not from system reform, but rather the criminal justice system having a slowdown because of COVID-19. I do want to note that this is the system as a whole. Jails, sheriff's departments, and police departments are, again, usually run by city or county governments. So there really may have been more movement toward reform on local levels. All right. There is no great transition, but here I am. So I'm really, really excited to introduce our first presenters. I really look up to these ladies, and I want to be them when I grow up. So Megan Peterson is a research scientist at the University of North Carolina at Chapel Hill School of Medicine. She was the project director for the COVID prison project and is interested in using health research methods to understand and ultimately eradicate the prison industrial complex. Her research is focused on criminalization of substance use disorders, sex worker rights, and access to medications for addiction treatment. Dr. Catherine Nowotny is the co-PI of the COVID prison project and an associate professor of medical sociology at the University of Miami, where she directs the Miami Health and Justice Lab. Her research focuses on multi-level factors that increase risk for poor health among justice-involved people. I again want to welcome both of them right now, and I think that Megan is going to share her screen. So let me know if you can do that.
All right, are we seeing my screen here? Ooh, actually, 1 second.
Perfect, yes.
Okay, great. Thank you for that introduction. I'm so excited to be here for this workshop today. So my name is Megan Peterson. I am the director of the COVID prison project, which is based at the University of North Carolina, Chapel Hill, as well as the University of Miami. I am filling in today for Dr. Lauren Brinkley-Rubenstein, who is a founder of the project, but I am also joined by Catherine Nowotny, who will be talking about some other initiatives surrounding COVID research in carceral settings, but is also a founder on this project. So today I will be talking about lessons learned from the COVID prison project. I am going to start by talking about some background on COVID-19 in carceral settings. I'll talk about the founding of the COVID Prison Project and our methods, some findings from the project, and then Catherine will spend some time talking about the RADIX research study that we have going on, which is a rapid diagnostic testing project, specifically in carceral settings, and we'll spend some time talking about next steps. So first, to give a broad overview of the impact of COVID-19 in carceral settings across the United States, we know that the United States leads the world both in number of COVID-19 infections and also in mass incarceration. The United States has about 5% of the world's population and about 25% of the world's incarcerated population. So both the confluence of high rates of COVID and high rates of incarceration have really created this syndemic behind the walls. As of this month, according to our estimates, and I'll talk a little bit more about where our numbers come from, but we have estimated that over 2,800 people in carceral custody have died from COVID-19. That is an enormous number of people, and we also imagine that that's an undercount, given both that often systems don't report out numbers of deaths, as well as a high number of deaths being misattributed to other causes that aren't COVID-19. We don't have a good evidence base so far for how COVID-19 spreads in correctional facilities. We know that there are different mitigation strategies that can be deployed to prevent COVID-19 infection, but given the built environment of carceral facilities, it's often hard to contain spread. So Catherine will talk a bit more in her presentation about some of our RADIX research looking into built environment. And then another sort of big theme of this presentation is that across the United States, data reporting and mitigation strategies are often inconsistent. The United States prison system is highly decentralized, and every system reports out information on COVID-19 differently, as well as policies state by state also differ. So to give some background on why carceral settings, in addition to just having a high volume of people comparatively with the rest of the world, are such spaces of risk, there are really a few things going on. So the first thing is that there is a high burden of comorbidity among people who are incarcerated. So we know that a fourth of the incarcerated population has a chronic condition. There are high rates of, compared to the general population, HIV infection, substance use disorder, mental health needs. And so this is a population that is at baseline susceptible to both COVID-19 morbidity and mortality. Additionally, carceral settings are places where it's very difficult to engage in social distancing. Additionally, as the incarcerated population has increased in the United States, even with the decreases that we saw during COVID-19, often facilities are still overcrowded. And the other factor that puts people who are incarcerated at risk is that within these systems, there is a lot of mistrust of healthcare systems and personnel. So we want to emphasize that, you know, when you are in a carceral setting, if you test positive for COVID-19, there are often collateral consequences, such as being placed in isolation. And so therefore, there is some reluctance among people who are incarcerated for both testing as well as vaccination, given the historical mistreatment of people in the United States prison system. So that's really the background. And I'm going to talk about what the COVID Prison Project is and how we got there. So in April 2020, our team noticed that there was really no centralized source of COVID-19 data on prisons. And I am going to focus primarily on prisons in this presentation. So we did collect data on the 50 largest jails in the United States. But in this presentation, I am referring to data collected from all 50 United States prison systems. We've collected data from the Bureau of Prisons, Immigration and Customs Enforcement, as well as Puerto Rico. So that's really our scope. But back in the early days of the pandemic, there was no centralized place to understand how COVID-19 was affecting people who were incarcerated. However, something that our team noted was that many systems that historically have not been so transparent with health data suddenly overnight were providing these piecemeal data dashboards. So system by system, often departments would put up daily a number of tests in their system, number of positive cases, number of deaths, and later on vaccinations. And so what we have done was we created the COVID Prison Project to go out and look for data across different systems and try to aggregate it into one singular data set to understand the spread of COVID-19. So this is what our website looks like. This is the COVID Prison Project homepage. And so again, the rationale for this project was to collect data using a public health oriented framework. So this is our dashboard. We also do have a day-by-day data set that's available on GitHub, and I'm happy to share that with anyone who's interested. But essentially, we collected data from every system and scaled it up into this dashboard. So we collected information on the number of cases among people who are incarcerated across all 50 systems and those 3 others that I talked about, the number of deaths, metrics on staff outbreaks, and later on, as it became available, vaccinations. And I want to talk a little bit about sort of the mechanics behind this data collection, as well as the many challenges. So first, why is this important? Why do we want to know how many people have COVID at any given time? For one thing, it provides transparency on conditions behind the walls. We've seen often that health data produced among people who are incarcerated are provided at a lag and are not always transparent. So the utility of this project was to create a single source to understand the spread of COVID-19. This was also a centralized resource for people to both get information on conditions in facilities where friends and family members may have been detained, as well as at times report conditions. So we had a number of contacts from either people who were incarcerated or their loved ones to ask, what's happening in this facility, or here's something that my loved one is experiencing. And so we were able to provide some transparency, particularly with media. So the project was also a go-to source for media stakeholders across the United States to both get a sense of conditions within specific states or nationally, and was also a foundation for legal research to fully understand the spread of COVID. And so our findings and challenges. So again, in order to extract these data, we had daily data entry by trained research assistants who would go to Department of Corrections websites, or in some cases, directly get data from correctional partners. So we did a lot of manual data entry. And then we also did some web scraping extraction. So what that means is that we had what are like bots that are like trained to go out and look at certain websites and at a certain time interval record all the data on that page in an Excel sheet. So using a combination of manual extraction and web scraping, we had daily information, and we found that the case rate typically was about 3 to 5 times higher among people who were incarcerated than in the general population. One major hurdle for us in ascertaining case rates is that often population data in systems that are updated in real time are very hard to come by. So it can be difficult to calculate a case rate given an unknown denominator. We did find often that reporting from departments of corrections was inconsistent. And so what we did was every day when we recorded the number of tests, cases, deaths, vaccinations, we embedded certain checks in our progress, in our reporting to look for changes. So if a system increased in cases or decreased in cases by 5%, that would flag a manual review of the data. Which meant that we were able to see when DOCs were reporting out cases that were incorrect, or at some point, we noted that the Bureau of Prisons cases were actually decreasing daily, like the cumulative number of cases. And the reason for that was that the Bureau of Prisons stopped counting people who had been released from custody. So we were getting a deflated number every day. So inconsistent reporting, sometimes mistakes in the data. We did have a lot of deaths that were missing, so many states stopped reporting death data at some point or never reported it. And a big turning point in the project was really the summer of 2021, pre-Delta. We saw a lot of states started to sunset their COVID-19 dashboards as public attention on the pandemic waned, meaning that we were no longer able to capture COVID-19 metrics in those states. And then another big challenge is that vaccine data has been somewhat uninterpretable. About every system records vaccinations differently, so some give us the total number of individuals who are vaccinated across the system. Some give the total number of vaccines dispensed is in one number, regardless of if that's number of first doses, second doses, booster shots. So it has been really difficult to compare findings across states. And that's something that we've seen with other metrics as well. So for example, in testing numbers, one way to understand if a COVID-19 outbreak is controlled or not is to look at the percent positive, so the number of positive tests over the number of total tests. But across systems, we saw that, some would give number of individuals tested, some number of total tests. So there were a lot of challenges in data collection. So, there are some lessons learned here. We learned over time the importance of consistently documenting fluctuations in the data, having real-time monitoring of changes, either to say, oh, wow, this number really increased, there's an outbreak here, we know this in real time, or something's wrong with the data is important. Using web scraping, we realized that process actually needs a lot of human oversight. So if a website changes from one day to the next, it will often break a web scraper. And another really important partnership that we learned about and generated through this process was media connections. So it was really important for us to be a go-to source of COVID-19 information and often break down metrics that are not necessarily intuitive into ways that are easily understood by the public in order to measure COVID-19 spread. And so I will be available for questions about the COVID Prison Project at the end. You can also look at our website, covidprisonproject.com. But now I'm going to turn over the presentation to Catherine, who's going to talk a bit about the RADx project.
Great. Thank you so much, Megan. And it's great to be here, everyone. I want to say thank you so much to Carly and Ricky for inviting us. And I also want to say, I know Lauren Brinkley-Rubenstein, sorry she couldn't be here with us today, but I want to recognize her leadership in both COVID Prison Project as well as the project that I'm going to talk about. So, as Megan just talked about, right? There's a lot of data limitations and a lot of challenges with trying to understand, incidence, prevalence, how COVID-19 spreads through facilities, using administrative data or data that were publicly available from different departments of corrections. So what we did is the NIH had an opportunity called RADx Up, and that's Rapid Assessment and Diagnostic Testing for Underserved Populations. And so this was a rapid grant process to really serve two purposes, right? To get COVID-19 testing into underserved communities and to provide additional shared research evidence. And so there were 125 projects funded, and we are the only project funded that's focused on correctional facilities out of those 125. And so the team is led by Lauren Brinkley-Rubenstein at UNC, Emily Wong at Yale, as well as Rosemary Martin at Brown University, and many other places. It's a large multi-team effort. And so what we're doing with this project is we partnered with prisons and jails from across the country. And as I mentioned, a large part of this grant is to get testing into underserved populations. And so we worked with our partners, our correctional partners, to identify what challenges they were having with COVID-19 testing and how we could support them. So for example, one partner we were working with actually had a pretty low prevalence of COVID-19. And so we were able to, work with them to do things like groundwater testing, right? Another partner that I'm working with in Florida had the challenge where testing sites for PCR tests were so backed up that it would take days to get test results back from the PCR, which really disrupted their ability to administrate in the jail, right? Because they would have to keep people in quarantine, keep the jail in lockdown every time there was a suspected positive case, right? Until they got PCR test results back. And so we were able to purchase them PCR machines so they could do their own on-site testing and get test results back within an hour, right? And so, each facility is really unique and the challenges they were facing. And so, the first thing we did was work with them to see how can we support them? How can we provide them resources that is going to help with the particular challenges that they were facing at different times throughout the pandemic. And then the second, goal of this project is to conduct research. And so, Megan, if you could go back to the previous slide for a moment, please. Thank you. So we had two research-based aims. The first one is to identify ethical concerns and potential solutions for COVID-19 testing and vaccine strategies, which I'll talk a little bit about. And the second one is to characterize the incidence of COVID-19, as well as the disease progression and related outcomes and effectiveness of different testing strategies, contact tracing, and so forth. So really our overall goal is to mitigate the impact of COVID-19 in correctional facilities and also develop best practices. So we are working with dissemination partners such as the National Commission on Correctional Healthcare, to develop reports that can be disseminated out to correctional facilities across the country. Okay, next slide, please, Megan. So these are, locations of some of our sites, or not some, of our partner sites. And so those include, Rhode Island, which has an integrated prison jail system, as well as Pennsylvania, Florida, Minnesota, and Washington. And it's a mixture of prisons and jails and these facilities. And as I mentioned, we're working with them on implementing different testing strategies as well as research. And so what I'm going to talk about now is the different research that we're implementing. So next slide, thank you. So our first aim, right, in terms of identifying ethical concerns is really a qualitative aim. And so we're doing two things, right? We did a series, we currently are, we're still collecting data, a series of interviews with people across sites. So originally we planned on doing, focus groups, and we planned on doing longitudinal. So we would interview people multiple times. But because of just changes in the pandemic, we've ended up doing one-on-one interviews with 3 different groups of people, right? So people who are currently incarcerated, medical staff that work at these facilities, as well as frontline COs that are working on the floors of these facilities. And so we're doing one-time interviews over the phone. Most cases, it depends by facility in terms of what their security protocols will allow. And the team that's conducting these interviews are formerly incarcerated people. And so Yale University recruited and trained formerly incarcerated people to serve as research assistants and conduct these interviews. And so to date, about almost 100 interviews have been completed across sites. And we will be wrapping that up soon. And I'm going to have some preliminary findings I'm going to share with you all. I think another really unique thing about this project is there was also a component that did content analysis of archival data. So a team, again, a multidisciplinary team that included historians as well as formerly incarcerated people, trained as research assistants and students, did some archival research, including looking into archives from the Eastern State Penitentiary in Philadelphia, as another archives to do research projects related to flu pandemic outbreaks, previous outbreaks of flu pandemic, previous outbreaks of HIV, to see what we can learn from these previous pandemics that are in archives, from writings produced by incarcerated people, as well as staff and other people who lived through these historic moments. Next slide, please, Megan. So some of the preliminary findings, I'm not going to talk about all of these, but I think one of the I guess sort of easiest leverage points that we heard is thinking about communication. And so information and communication. And this was something that was brought up by incarcerated folks as well as COs. So there was a lot of people shared with us that they felt that there was just a lack of information, a lack of knowledge about what was happening, about what policies were from leadership. And so COs mentioned that it sort of depended on the shift leader, right? COs often work in shifts. And so depending on who the shift leader was, there was, better or not so good communication about what was happening in the facility. Incarcerated people in particular, it was related to communication, but also testing, oftentimes reported not getting their test results back, or they only got their test results back if they were positive and not negative. So there was a lot of uncertainty about, did they just forget to tell me, or am I actually negative? And being able to, I think have clear communication guidelines for targeted at, different populations within the facility is sort of a really easy strategy that can be implemented. And then also testing results, right? So being able to give people negative test results in addition to positive, and do so in a way, that's as, private and maintains confidentiality as much as possible. Next slide, please. So I kind of went into this a little bit, but some of our recommendations based on this is prioritizing sharing information about COVID-19, protocol changes as they're happening with both staff as well as incarcerated people. Making sure or including, people who are incarcerated in creating and implementing COVID protocols, right? They're the ones that are largely impacted and, have ideas about how to best implement these protocols within different units or within different dormitories. We also, as I mentioned, I think giving both positive and negative test results is another pretty straightforward recommendation. We also heard a lot from COs about their feeling like their emotional and physical well-being was not prioritized throughout the pandemic. And we heard stories of COs who are scared to go home because they didn't want to infect their family members. And there was a lot of staffing problems, not wanting to get tested because then they want to get paid, right? And they would lose out on salary. And so I think there was staff members in particular. I think while I think prioritizing people who are incarcerated as being most vulnerable is absolutely right. But I think staff people as the conduits, right? The conduits bringing COVID-19 at least into prisons and jails is a little bit of a different situation, should also be prioritized in different intervention efforts. Next slide, please, Megan. So for our second aim, this is our quantitative aim. And so we are working with our correctional partners from across the country, and they are providing us with just an incredible amount of data. And so we have some of that, here on the screen for you. Essentially what we're doing and, what I'm helping our community partner in Florida do is we're taking the administrative data, right, from that's used from the criminal justice side. And then we're taking electronic health record data from the medical side, as well as COVID-19 testing data. And we are merging these into a really large de-identified data set that is going to include every person who was admitted to the facility starting from January 2020 until the present. And so this includes, really detailed information about, medical isolation, vaccine dosing, type of vaccines, type of COVID-19 test, and I think in particular, things that we haven't known to date, medical comorbidities, because we know that things like chronic conditions that are associated with high risk of COVID-19 acquisition, as well as severe outcomes, right, or people who are incarcerated are overrepresented by these health burdens. And also other information about housing units. So we could look at how different housing units may contribute to the spread, demographic characteristics, and so forth. Next slide, please. So we're also getting clinical information, really detailed clinical information on COVID-19 in terms of symptoms that people reported and hospitalizations, which is something to date we don't have a good understanding of in terms of how many people required hospitalizations, the difference between symptomatic and asymptomatic cases. We're also collecting policy information. So we're getting historic policy information. So as these facilities or entities developed and rolled out policy and made changes over the course of the pandemic, we'll be able to look at longitudinal models of policy change. And I think importantly too, we're getting information on the built environment, which is something that Megan spoke about. So thinking about CO shifts, right? Thinking about movement around the facility. Our correctional partners are giving us maps, right? So we can actually look and have an understanding of population flows and congregate settings within the facilities. And we're going to use all of this information to not only have robust estimates of things like prevalence and daily incidents, but also to do stochastic modeling or agent-based modeling to look at disease outbreak transmissions throughout this facility throughout these facilities over the course of the pandemic. And so there's going to be really dynamic disease-based models that are going to be able to model, as I mentioned, the disease outbreak within the facilities and see like how it's spread within the facilities themselves over time. And so we're going to get a wealth of information, and we're really grateful to the correctional partners that are helping us or partnering with us in this endeavor. Next slide, please. So I think a couple of lessons that we've learned already. This project is still ongoing, but there have been, as you can imagine, a lot of complex barriers to data sharing. I mean, we're definitely making it work. There's a lot of lawyers involved. It's also difficult. It's been difficult in maintaining partnerships because the pandemic is ongoing, right? So at different times, our correctional partners have been in crisis, right? With the Omicron variant, a lot of our partners were, just in crisis mode, trying to handle the pandemic. So it's been sort of ebbing and flowing throughout this process. I think, we've also learned that there's a really strong need for adaptable testing strategies. So there's not like a one size fits all approach, right? Each of our partners have very different situations, very different relationships with their public health departments, very different access to resources, to testing equipment, to PPE. And so having an adaptable approach that works for the local context is absolutely necessary. And then, thinking just more generally, taking a step back and thinking more generally about, public health oversight within correctional facilities, and really the need to have more integration between public health and corrections or correctional health. Next slide. So this is our final slide. And so I just want to share with y'all, a couple of our long-term goals or where we are going. So as I mentioned, we're going to be doing really fancy disease outbreak modeling with partners at Stanford University. We are developing ethical guidelines that will be distributed through our dissemination partners. And we are also, and this is something we can talk about, and I'm sure Megan would be happy to talk about this later, is we're developing out the Third City Project, which is a continuation or a build on of the COVID Prison Project, right? So through the COVID Prison Project, we've learned that we can use web scraping, we can use FOIA, we can get all kinds of information from correctional facilities, but there's a need to have it standardized and digestible and put forth in a way that is publicly accessible for policymakers, for advocates, for the media. And that's what the Third City Project does. So it's building on the infrastructure of COVID Prison Project to move beyond just COVID, to look at other things like mortality and other morbidity, as well as population counts. So thank you very much for that. And I'm really looking forward to the other presentations. And we will join y'all back during our discussion session. So thank you.
All right, thank you, Megan and Catherine. That was fantastic. While we wait, I want to say thank you. I actually have been familiar with the COVID Prison Project and your RADX project since the beginning, but I learned a lot. And I think that these efforts are enormous, to say the least. So I want to say thank you. And I know that Carly, who mentioned she's in the middle of her dissertation for her PhD program, has partnered with the COVID Prison Project and is using their data for her dissertation. Any words of wisdom, Carly?
Just a huge thank you. That's all I've got is a huge thank you.
Yeah, so we're happy to help. We're also big fans, as I mentioned, of Ricky and Carly. And as Megan just put the email in the chat, and so we are happy, we are open, we are 100% open source. We are happy to share any and all data. We can create custom data sets for you. We have general public data sets online. We also have a bunch of policy data. And so we're really open to either collaborating or sharing data. And I'm super excited to see what Carly comes up with and, to attend her dissertation defense. So thank you.
All right.
So, Gray, I have a question.
Yes, go ahead, Dr. Gray Eyes.
With the data collected during the COVID period to study, were there any that was collected from the tribal jails?
So there was not. One of our partners for the Radix project is in Washington, and they're not located on tribal land, but they're located adjacent to tribal land, and they house a lot of, they have a partnership with the local community, and they house a lot of tribal people.
Bureau of Prisons?
Excuse me?
Sorry, was the question, did we collect from the Bureau of Prisons?
No, the Bureau of Prisons doesn't collect any from Native American correctional facilities, detention facilities. So I was just wondering if you worked with the Bureau of Indian Affairs to get any of their data, who they basically oversee the tribal jails and the correctional facilities. That was my question.
Yeah. So we did not. We have not. None of our partners currently include any tribal jails. As I mentioned, we do have a partner. The jail, it's a county jail located adjacent to tribal land, and so they partner with the local tribe and serve as the jail for the tribe. And that's one of our partners, but they're not, overseen by tribal government. But they're our tribal adjacent partner that we have. But we have not reached out to the Bureau of Indian Affairs, no.
Okay, thank you.
Yeah, great question. Thank you, Dr. Gray Eyes. Maybe a direction I'm thinking of our group here at NAU and a direction to move forward, maybe partnering with.
And I think, and that's what Carly is doing with her dissertation, right? So she is working very hard to fill that gap, right? That is a gap that we have. And I know that's what Carly is adding to CPP through her dissertation research, which we're really happy about.
Okay, thank you.
All right, well, thank you so much, COVID Prison Project. I'm going to introduce our next group. So our next presenters, I like to think of as friends who I've been working with for a few years now. You'll have to ask them if they think the same. So Captain Richard Martin began working with the Yavapai County Sheriff's Office in 1994 and was promoted to patrol deputy a year later. In 2008, Captain Martin was promoted to sergeant, to lieutenant in 2013, and captain in 2016, and we're excited to have him here. Bea Thayer is a systems advocate supporting enhanced collaborations among multidisciplinary teams and enjoys the opportunity to work as the executive director of the Yavapai Justice and Mental Health Coalition. She works to develop and implement strategies that lead to the long-term and sustainable involvement of community institutions, organizations, and individuals with the intersection of justice and behavioral health. Bea has a master's in social work from Arizona State University. I think I can forgive her for that, and has worked extensively in social services for 25 years. Again, I am so excited to have them here and welcome you all here today.
Thank you, Ricky. And NAU did not have the master's program at the time that I was going through. So, yeah, there was a lot of miles put on the car, but we made it. I'm going to introduce myself really quick, and then I'm going to hand it over to Captain Martin to introduce himself and start off with the data. But we're really excited to be here, and yes, we are. I consider NAU Center for Health Equity Research our BFFs for sure over here at the jail, and with the programs that we do. Captain Martin and I are going to talk about pretty much just what happened when COVID hit. He's got a lot of data to share about what these numbers look like of people coming in and coming out and what the protocols are that we had put into place, and how they had to get adjusted as we went along. It was really great to hear in the previous presentation that there's some outside eyes looking at what happened and during the pandemic with all these different institutions, to be able to come back later and say, here's some opportunities for suggestions to implement, because as you know, when you're putting out fires and you're totally in the weeds in the forest, right? You got to take care of what's happening right here and now. So I really appreciate that COVID prison project, and I am really looking forward to seeing some of those suggestions about ethics and how to support moving forward, because I have a feeling this won't be our last outbreak of something happening. And Yavapai County Sheriff's Office has worked really hard in implementing lots of programs within the jail to support people who are incarcerated, and as well as a huge coordinated reentry process and program to support people getting connected to services and back on their feet afterwards. And so I will jump back in after the captain goes through some of his data and explain how that affected us as well with this pandemic. So for those of you who aren't very familiar with Yavapai County, I just wanted to throw this map in here. So on the top left, just to give you an idea, especially our friends from the East Coast, this county is literally geographically the size of the state of New Jersey. However, we only have about under 250,000 people who live here. So it's very spread out. There's mountain ranges that go through and it's beautiful. There's desert, there's tribal land. And this bigger picture is not the entire county zoomed out. It's just this small, I don't even think it's 10 square miles. I don't know, but smack in the middle, it says Yavapai County Jail. And then right next to us, and this is off of Highway 260, as though you were going to go on off of I-17 from Camp Verde, where the Starbucks is, into Cottonwood. We're just at the beginning of that. And we share a parking lot next to a shooting range, and we share a parking lot next to Out of Africa Wild Animal Park. And that's it. We're pretty much isolated out here. And when we come back to start talking about reentry planning and how COVID affected that, I want you guys to have this vision in your head. All right, I'm going to hand it over.
Okay, thank you. Also, thanks to Megan and Catherine. I think a lot of their talking points on there are going to be supported in here. I think that you'll see some discrepancies from what they said, but I think a lot of what they said in here you'll see confirmed with some of our data. Now, granted, we're relatively small compared to the population that was studied by Megan and Catherine. However, you'll see some sample sets here. The data for pay attention here obviously would be from 2019 and forward. 2020 is when we saw the onset here. We did restrict misdemeanor bookings, and that had a direct impact on our average daily population. We saw a drop for 2020 down to 477 for our average daily population. We did open up in middle of 2021 to the misdemeanor bookings, and we did see a year-end average daily population there of 519. Year to date for 2022, we are sitting at 531. If you'll hit the next slide. You'll see here that we broke it down further by average stay by classification, and you'll see here that the previous slide with our ADP was the whole population in whole. So here's our average stay by classification of their charges that they're held on. And one of the biggest things that we've seen has been a slowdown in the judicial system itself. There's not one in particular partner in there that has had, that I would point fingers at for this slowdown. It's been kind of a overall slowdown. It's because if you have one part of the wheel that stops turning, it really impacts the rest of see that the felony, while we worked really closely with our court systems, our local judicial branches, to work on getting the misdemeanor and the low-level offenders out quickly, the felony cases have really slowed down in moving through the system. And there's not, we're working diligently with our partners now to try and come up with some solutions for that. But there's been a lot of different things that have impacted that. There's several programs that we can't continue to offer because of COVID and the pandemic that's been going on. For example, work release has been a program that we have completely stopped, and we're only looking at opening it up probably sometime this year if we continue to track with the same pandemic numbers that we're seeing right now. So next slide. Here I've got these are true numbers for year to date for 2022. And you'll see that the average length of stay, so this is for all inmates in our custody, including felony and misdemeanor. And you'll see that we have a large swing in the data. That's because that, as cases get adjudicated, if we release 200 inmates through the month of February, and a large number of those were felony cases that have been in our custody for a long time, and they get sentenced and transported to the Department of Corrections, that has a huge impact on that average length of stay number. And so oftentimes we'll start to look at the median rather than looking at the true average. The formula for that average length of stay is to look at all inmates that were released for that month and calculate the total number of days that they were served. And then we divide that number of days served by the number of inmates. So it's a true average. However, when you start to look at the median, it kind of tells a little bit more of a realistic, because it's less impacted by those outliers. However, you'll still see that February, even with the median, we did see an increase there. This next slide here, this really speaks volumes to what we've seen. In 2019, we had a total of 8,040 bookings, and that equated to a total number of inmate days of 187,693. Conversely, I kind of eliminate 2020 because it was such an oddball year, but I did provide that data in there. In 2021, we had 6,522 bookings. That's 1,500 less approximately than in 2019. However, if you look at our inmate days, we had, despite the fact that we had 1,500 less bookings, we had 1,800 more inmate days. This really, again, just speaks volumes to the slowdown in the judicial system. We're not seeing the inmates move through the system at the same speed that they did pre-pandemic. And again, that just goes to that, whether it's some of the programs that we're no longer able to offer, whether it be inmate programs or just the slowdown in the judicial system itself. So right from the beginning, we started reaching out to our partners and trying to come up with different ways to handle the pandemic. We immediately instituted a quarantine process. We started off with 14 days for all new inmates. We kind of reconfigured the flow of our inmates through the facility. We converted our transfer hallway into a temporary holding facility that all new bookings would stay in there for a period of 24 hours until after their initial appearance. And then if the judge had held them on bond or they were unable to be released immediately, then they would move back into a quarantine dorm into the regular housing facility of the jail. This really affected our flow of inmates. So it's not, the facility was designed not with the pandemic in mind. And so that affected our ability to move inmates for court, et cetera, by taking up that valuable real estate. So we have since gone back to immediately housing inmates into quarantine dorms in the back of the facility, into the regular housing area of the facility. We just designated 2, sometimes 3, depending on the number of bookings, dorms for the quarantine dorms. We have partnered up with a big thank you to Spectrum Healthcare. They came in, they offered 2 different dates that they came in and did vaccinations, and we had a total of 446 doses. But very similar to what Megan and Catherine had mentioned, that number is not documented for the, I guess for those were single shots that were given. So I don't have numbers for the number of people that would have received a full vaccine to include 2 shots, etc. So they were spot on with their data there. We just didn't track that. We didn't have a way to track it at the time. We did have for pandemic, so from beginning of 2020 until to date, we've had 94 individuals incarcerated that have tested positive. Many of those testings did occur outside of the facility. So we do not test an inmate upon release or upon entry. We only tested them if they exhibited symptoms. And so some of these individuals that are represented here in this 94 tested positive at third parties. For example, if they got released to DOC, the Department of Corrections did do testing upon entry, and they would report back to us, and those numbers are included in that, the 94, along with the release to third-party providers. So, for example, if a person got released to substance abuse treatment or to mental health, they would be tested upon entry there. We did recently just receive our first PCR machine, and we will be looking at doing some of that testing here, especially for those third parties. The employee protocols, we started off with doing temperature checks and stuff like that at the beginning of the pandemic. I don't have any data to speak to this, but we really didn't see anybody coming in with a fever. There was nobody that was checked and said, "Oh, you've got a fever, so you need to go home today." Everyone pretty well knew if they were sick or not. And so we stopped doing the temperature checks for the employees. I will say that we do not have a mandated vaccine for our employees, for our corrections officers. And conversely, we did see a larger number of employees when compared to incarcerated individuals that tested positive. We had almost twice that number of incarcerated individuals when compared to employees. So we had close to 180 employees that have tested positive since the beginning. We did drastically increase our cleaning protocols. We do spray down with disinfectant at least twice a day, all the common areas, and we really tried to step up that. There was big concerns with the understaffing. We had, either due to sickness and then also just a very large number of vacancies. And so that's always been a struggle through all of this as well. We did also immediately partner up with all of our counties. In fact, I hope Matt Figueroa is on here. He's a jail commander for Coconino County. And so the Sheriff's Association, all the jail commanders would get together weekly, sometimes bi-weekly, and discuss strategies and try to look for trends and other ways to mitigate the COVID processes through here. We were all on the same page with eliminating a lot of the programs, the outside programs, where an inmate would be coming in and out of custody. For example, work release it's still, I don't believe any of the counties in Arizona have implemented work release yet. When we did receive information back from a third-party provider that an individual that had been in our custody had tested positive, it did not always result in a lockdown of that dorm again. We looked at it on a case-by-case situation. If that individual had been in custody for a long time and had been in the open day rooms with the other inmates in there, we really didn't see the point in locking down the dorm again. And so they would remain, and we would watch closely, and we would try to limit the movement in and out of there. We wouldn't put new inmates in there, but we would just watch their health conditions in there more closely, However, we didn't reverse it and put them back into quarantine. We would just let it run its course. And we didn't see any large outbreaks inside. However, there was, we ran into some overcrowding issues with the quarantine dorms. And so we were always looking for ways to shorten that up. And so what originally started off as 14 days, eventually went down to 10 days. And then there was a brief time right before the Omicron variant broke out when we tried 5-day quarantine period. Well, that didn't go over very well. We immediately saw a large spike in our numbers that it just lined up perfectly with the Omicron variant. And so we immediately went back to the 10-day quarantine. So that's, I'll be available for some questions after this, but I think that's most of my talking points, Bea.
Thank you. Great data. So beginning about in 2015, the Yavapai County Sheriff's Office started looking at how to increase programs in the jail to support people with mental health needs, substance use needs, folks who have, major social determinants of health needs, employment and housing, and trying to bring in additional volunteers and people from the community that specialize in providing education and resources to this population. Like I said, to strengthen them where they're at, whether they're going to go to DOC or be released, and try to come up with some planning and diversion abilities so that folks can get out of jail even sooner than later, and get into the hands or support services or wraparound services in the community to meet their needs. And of course, the justice system looks at it, so that they don't continue to find themselves with additional charges or not maintaining their terms of probation. As a social worker, I look at it as, trying to meet people where they're at and give them the supports that they need to make it through the day and support their families and find a safe place to sleep and to eat. And you got to take care of all of those basic needs. You all know that. And definitely, if you've got a lot of stress going on with your basic needs, how are you even going to take care of your justice needs also, and when you're supposed to go to court? So it's this big, huge package. And Yavapai County was chugging along and getting really robust programming in place for our programs inside the jail. The calendar was booked. There was no more space to allow any more classes. And we have a programs classroom, and the detention officers, of course, they would have to figure out who's coming into what class and go around to the different pods and pull people out. And it takes a lot of work to get, a group of 15 people into one space over here, and then to get them back into their dorms and where they're supposed to be, and to get our volunteers to come in or outside providers to come in and work. But it was moving along. For our coordinated reentry program, which is called Reach Out, we have civilian release coordinators who will meet with every individual upon their booking and give them the opportunity to participate in a screening. And that screening identifies mental health, substance use, and social determinants of health risk factors. And then they start talking to them about, what services do you have in place? Do you have a safe place to live? Do you have safe transportation? Remember that map route next to the tigers? It's kind of scary when you get released, after dark. Is there a way that, depending on your charges, that actually we can give to the courts and say, hey, here's Bea, who has identified moderate to high risk for these needs, and we can get her directly into somebody's arms, into services upon release, And that could be inpatient psychiatric hospitalization, residential treatment for substance use disorder, transitional housing. Catholic Charities and us, we have this great partnership for some great transitional housing. Other places, Angie's house is in Cottonwood, and she's got housing scattered throughout, the community, and is always open to working with our population. We get grants to help offset, the first few weeks, even a month in somebody's housing needs. Who can drive folks to different places? We work with our providers and say, hey, Bay is going to be out today about 1 o'clock. Because of that map, a lot of times it takes about an hour and a half to get somebody to the other side of the mountain and walking into that lobby. Can you make sure that you have your intake person ready to go to greet them while the person is there? We work really closely with probation. We have folks that come in on a probation violation, and the court has said, okay, well, Bay, you're going to be sentenced to 90 days, but hey, we'll let you out early if you go straight into residential treatment, because this is the 3rd time you've been arrested due to your substance use. It's directly related. They can see that it's related. We've tried outpatient before, it's not working, but let's get you out of jail, because you all know this is not a therapeutic setting whatsoever. So it was jamming, it was going great, and COVID, of course, just ripped everything out from under us in that. So if you can think about a lot of you all who are outside providers and what you went through with your staff and your policies and how they changed week by week about if you're going to see somebody directly in person, if you're going to see them over telemed, who's working from home, are you going to put somebody in your own car and drive them anywhere? So we lost that smooth reentry planning that we had going for us. So for example, the residential, for substance use residential, of course, those facilities need to know what a person's COVID status is. And do they have COVID? If they do have COVID, is this facility able to accommodate them to quarantine somewhere else? Or do they want them to go, for a while, we're trying to say, okay, we'll set you up in a hotel and we'll have Catholic Charities come and check on you on a regular basis until you get a negative COVID test. The COVID tests that we had at our fingertips mostly were those rapid COVID tests, which didn't always have the same results as a PCR test. And the PCR tests were taking days to get the results back. One of our local, that transitional housing entity here in Cottonwood in the Verde area that was so useful, they put up a definite moratorium on taking anybody from the jail institution setting. And I understand, I mean, it sounds like, oh my gosh, we have all these people in this huge populated area. And as you know, our presenters earlier this morning were explaining, like, how do you know who it's spreading and where it's spreading to? Our partners on the outside were asking, hey, could you do a test on somebody 2 weeks before they are to be released, and then put them in quarantine for those 2 weeks so that we know that they're not going to be exposed to COVID before coming into our facility. And as it was mentioned, I mean, quarantine, we do have another person in that cell, you know, you're not solitary confinement, but that's another burden, right, to put on somebody. And how do we mitigate a lot of those requests? And they were constantly changing. Again, which test are we using on somebody? Are we using the PCR test? Are we using the rapid tests? And then of course, our providers on the outside and all those cogs in the wheels that keep spinning, when they stop and they have an outbreak, or they have staff that need to stay home to follow their protocol, everybody's kind of starts losing the staff to be able to make those transitions happen. Again, that inmate movement during COVID had to come to an end, because we also needed to understand, okay, well, if there was an outbreak, if somebody is positive, and if they've gone out to a classroom with 15 other individuals who might come from 3 different pods, and one of them shows up positive, then everybody would need to be on lockdown. We all experience this with those of us who have kids in this, like younger kids going through school, about what that means, that everybody needs to be in their own special little cohort. As Captain Martin also mentioned, the staffing dipped. If we had our officers who are out on a protocol, on quarantine protocols, people weren't racing to find a job at the jail in the midst of a pandemic, when, you know, there's this fear of, okay, you're going to be inside the building, and what if there's a spread that comes out, and how vulnerable are we making our employees? Also, that having people from the outside, all of our volunteers and our behavioral health partners coming in, we had to put an end on that one as well. So that packed calendar just completely dropped. We do our education courses for those who meet those requirements, and we try to do a lot on some tablets, and I'll get to that later, and try to pick it up. We've finally started back our moral recognition therapy, which is a CBT model, but of course that's for a very small population as well. So that was a huge stop. Work release, Captain Martin mentioned work release, and what's huge about that is that people are able to continue to keep their job in the community while they serve their time in jail. And we all can understand that an arrest and a sentencing, whether it's 48 hours or 48 days, you can lose your livelihood, you can lose your housing, you can lose your job. And because of that influx, that there would be people out in the community coming back in, and the fear or the knowledge that they then can bring in COVID, and it again can spread. There was a huge moratorium across, I think, all counties on work release, and we are definitely working on how to bring that back into our system. So I put this quote on here. Of course, I can't ask him, but I'm thinking that President Mandela was maybe thinking about the people who were incarcerated, like himself, when he made a quote about prison and needing patience. But we saw that it's all the different players. It's the whole community. So yes, it's definitely the folks who find themselves incarcerated. It's our folks who work to keep them safe while they're in here. It's our cooks in here. It's our community providers, our housing providers. Everything changes so quickly, where it has brought on a whole other level of patience. And of course, you got to look for some of the, silver linings out of there. One, those numbers of misdemeanor arrests, if it were up to me, I'd say, do we really need to bring back the whole misdemeanor arrests? But what we need to do is increase that pre-arrest deflection and provide our community, law enforcement, first responders, crisis responders, social service providers, the ability to have a way to deflect people from coming into jail who don't need to be here. So many people have contact with law enforcement, and that could be used as a means at that moment to help get them into a support system that they need. Why not everybody needs to come through our doors in order to get that service. We started video initial appearances. And at the initial appearance level, that's really, really great. You saw that huge map. If somebody needs to go to initial appearance from the Verde jail, that's an entire day of transportation to get everybody all ready to go on the bus, drive them all the way over the mountain, bring them all the way back. And then if they're like, okay, then you get released, it just takes up an entire day and it delays a lot of folks' release. However, we've also seen we need to help advocate so that people who are incarcerated needing their public defender, that they can get some of that face-to-face time back, because that's really, really important. We have tablets that we share with all of our folks who are incarcerated, and we're in the process of loading those tablets up with a bunch of curriculum for, you know, mental health, parenting classes, some of the things that they have missed out on the programming. And of course, we all know how important telehealth has become during the pandemic. And we definitely want to ensure that telehealth stays as an opportunity for folks, whether they're incarcerated or in crisis on the outside, so that they don't come in. And with that, I will pass it back over to Ricky.
All right, thank you so much, Bea and Captain Martin. This was fantastic and really just very informative, I have to say. So I really appreciate the perspective. We're going to wait for questions for Captain Martin and Bea Thayer till the panel and the question session. And I am going to introduce our next speaker. So I'm going to share my screen again. So I have to say, I am absolutely 100% thrilled to introduce our next speaker. Dr. Dolores Gray Eyes, I have to say, an Indigenous visionary, is the director of the Navajo Department of Corrections. Dr. Gray Eyes fights for social justice on Navajo Nation, and she earned her bachelor's and master's of social work from Arizona State University. And in May 2018, she was honored with a PhD in social criminal justice. Her research focused on the perspectives of Navajo adult prisoners on their experiences from school to prison. Her research came after working as the Navajo Nation's corrections director and finding little to no resources to support various intervention strategies to support the nation's criminal justice system. Her research was the first of its kind, focusing on the Dene people, and I hope it's not the last. Thank you so much for being with us today, Dr. Gray Eyes. I am going to turn the control over to Erin, who will share your screen, and I am gonna mute myself so I can listen.
Thank you for the introduction, and I want to say that the research continues. My daughter at University of New Mexico, Dr. Wendy Gray Eyes, is also doing some work that ties in with my dissertation, and our work continues in that area. So, but I also want to add to the introduction. I started work in 2003 with the Navajo Department of Corrections, and currently continue to serve as their leadership team. And one of the things that I walked into in 2003 was just basically lack of facilities. And so I think that really has impacted lack of facilities, lack of well-paid correctional officers, lack of services within the facility, just a lack of understanding throughout the Navajo Nation and what a jail, detention, corrections, what those facilities really do. And oftentimes, as a result, we get the least attention, although we're hurting as well for manpower, funding each year. The focus really is on patrol. I always tease my colleagues that, because you're out there with your flashing lights, then obviously then you're going to get the attention. But that's just kind of some humor between us. But I wanted to say that Navajo Nation is unique in running its correctional facilities. And most tribes you'll see will run one facility that might have an adjacent juvenile facility with an adult side by side. But with Navajo, we have 4 long-term facilities for adults for a total of 296 beds serving. Obviously, we also have some temporary beds in those facilities as well. And then we have 2 temporary receiving facilities that are feeders into the other 4 facilities while we're working on for new facilities. And then we also have 3 long-term juvenile facilities, which we really didn't use during the COVID because of we nearly totally went into a total shutdown here on the nation because of that. And I'll explain. And these facilities are scattered across the 28,000 feet or miles of land in a very rural area where medical facilities are very sparse throughout. And so you can imagine from that just how difficult things were for us when the COVID broke. And the other thing is that across all of this, I have right now 129 officers. I lost 40 officers during the COVID, and very similar to Captain or with the Yavapai County, a lot of the officers did not want to take COVID home. So I wanted to use that sort of as an introduction to, a further introduction to what is happening or happened and continues to happen here on the Navajo Nation. So next slide, please. Okay, let's skip to the next. Where the charts are. There, thank you. And this really, no, I better, excuse me. Let's go back 1 slide. In addition to this, one of the things that we did, I apologize for this, I'm a bit nervous in doing this, but how we responded to the COVID is that in March 2020, we got together with our colleagues, the courts, the chief prosecutors, Navajo police, and the office of the president to really begin to think, how will we deal with this? Because we knew that the population that we were serving was very isolated into facilities across the nation, and there really wasn't a lot of immediate intervention that we knew would be available because of the lack of medical facilities. And so with this, we developed a plan as a team. And one of the things that we decided to do was that because we understood COVID to be most serious for those individuals who had health issues, particularly with the high rates of diabetes and heart disease and asthma, and then more recently cancer. And these are the folks that we needed to let go, and anyone over 60 who had served more than half of their term. So what we did, once we had the meeting, of course, you know, we had to mine that information and start to work with the local prosecutors and courts to get these individuals released from the facility. But there were also others that we knew that we had to maintain in the facility because we obviously couldn't release them for public safety reasons. So, and then we developed protocols and how we would address new arrests. What will we do at booking? The process of the COVID according to the CDC procedures became our new policies, and the questions that we would ask, the temperatures, and just really further just being a lot more in depth and assessing these individuals as they came into our facilities. And and then obviously we did get people that were showing certain symptoms of the COVID, and so we had to plan for isolation and monitoring right within this facility. And it was a good thing that we had 4 brand new facilities that have been built since 2013. So we had the ability to use some of the serving cells to help isolate these individuals. And so we got all of that in place, the cleaning process, getting the PPEs, getting our officers into gowns and so forth. So face shields, face masks, you know, the total works, and they look like Martians or people walk in space when they're doing the booking. And so those were all new things that we had to deal with. And then we continued our weekly meetings with our partners in the criminal justice system, as well as with the healthcare providers at each of the sites. And there's 7 Indian healthcare facilities. So we had a representative from each. And then, of course, the corrections lieutenants who were supervising at each of the districts. So we did weekly meetings, reviewed issues, and just continuously revising plans as we implemented policy to address the onset of COVID. And we also did training for our officers in a lot of these areas, doing better assessments, what to look for, how to quarantine, to clean, and so forth. And this didn't just include the corrections officers who are on the floor, but also the support staff that were maintenance, cooks, office specialists, and so forth. And then, of course, at headquarters, there's just myself and 3 other staff members that run the entire Navajo Nation Department of Corrections. So from there, we basically, one of the things that we did about halfway through the COVID was to train our corrections officers to do testing. So we started testing about late 2020 to test inmates that were coming into the facility so that, you know, to curb any movement of the COVID within the facility. And then, of course, we developed our data, internal data, collecting data for so that we can see what was happening and to share with our partners during our weekly meetings. So next slide, please. So here is a chart of what happened in the first year, 2020, as far as the COVID impact to our detainees. And the first year in 2020, we had a total of 176 individuals who tested positive, whether they were individuals that were serving or new arrestees that were coming into the system. So the chart shows that our first, the first individuals that came into the system was in Tuba City. We had 2 cases that showed up there. Obviously, in January 2020, the nation still was operating business as usual. And obviously, because of that, we did get a couple of, and then another one in March. February 2020, we were fine. March, we got 2 more cases, one in Tuba City and one in Chinle. And then in April of that year is when we started to see the spike slowly go up, with the highest being in May of 2020, when our count was at 25 that month, and a total 46 as far as the number of cases that were coming through. And then in June, it started to slowly go down. We had 19 that month, and then in July, we had 13. But a lot of the reasons that I think that we didn't get it so bad in the facilities. And this is these numbers are across all of the facilities. Now, if it was just isolated to one facility, but I would be worried. But I'm talking the 4 long-term facilities and then the 2 feeders that is Window Rock and Shiprock. So I felt okay in moving forward and then doing a lot of the protocols. And one of the other things that we did too was that when we found an individual positive that came in at booking, then what we did is we sent them up to the medical facility. There they determined to the extent that the individual had COVID, and the nation had isolation sites that were identified. So we were sending these individuals that were pretty sick to those locations. And I think from the onset, early on, we were learning. So obviously what we were doing was that anybody that tested positive that wasn't in danger to the public or themselves, we sent them to those isolation sites. But those that were aggressive, we kept them in the facility because we were able to isolate them in the different pods that in our new facilities, they all have individual rooms. So we had that capability to do that. So, and as we move forward towards the end of the year, although our numbers did spike again in the last quarter, it wasn't as bad as what happened in March, April, and May. And so then we go on into the following year. Next slide, please. So you'll see here it basically in January, like I said, in October, in 2020, our numbers started to creep up again. And so January of 2021, we creeped up pretty high. And one of the things that we also learned here was that a lot of the, because we were testing and we were isolating from the front end of new arrestees that were coming into the facilities, we were learning that some of this spread was coming from our own officers who, when they went home, apparently against the orders of President Nez, which really restricted any travel and so forth, continued to do some of that traveling. And so internally, myself and Captain Desiderio took further policy restrictions and put that into play for a lot of our officers. And so that we believe that helped to bring down, you'll see that the numbers are have dropped again in about February, down March and April. But in May, again, we started to creep up. And so we try to take a look at where the numbers were going up and down. And again, a lot of it in May is graduations and other things going on in 2021. I think slowly there were areas in the states of Arizona, New Mexico, and Utah, in which the Navajo Nation is, the land base stretches out into those 3 areas. They're going to graduations and other functions along that time. So it kind of created spikes here and there, erratic. So I want to go ahead and go on into the next slide. So that's for the prison population that we had, and going into the impact for correction officers. Next slide, please. Are we able to move to the, okay, there we go. So with the correction officers, then you'll see that in the large impact, let me see, hang on. Can we go back to the 2020 impact slide, the slide before this, that one? So if you'll see that the impact of our officers And I'm talking, we had 129 officers that was trying to continue working in facilities across the nation. We also had issues with needing to isolate individuals, and the light blue are individuals that we had to place in isolation as far as corrections officers who really got sick. And if you will remember, the onset of the isolation period was 14 days. So for each occurrence, we were losing officers for almost 2 weeks at a time. And then we also had to quarantine certain officers because they had the symptoms, or they were exposed but didn't have the symptoms. So those individuals we quarantined, and we were able to bring them back sooner than later. And so those were really erratic throughout. And I think a lot of it was, we believe, was due to their activity after hours, not so much any of the COVID was received while working. But also in next slide, please. So in 2021, you'll see how much of the impact and starting to really decline after February, slowly decline until we got less than 1 or 2 here and there that were getting COVID. And I think by this time we had implemented a much stricter policy as far as what corrections officers could do. As the nation, we already had restrictions against travel for everybody, the residents of the Navajo Nation. We couldn't travel off the reservation for much of 2020. But it seems somewhere our officers were still traveling. So once we implemented the strict policy on travel, that seemed to come down. The other is that we believe that because of the number of deaths that were occurring within families, and so officers were attending funeral services and gatherings in death situations, and we believe that's where they contracted the COVID and then came to work. And some of that we believe caused the increases in the facilities to inmates. Okay. And then I don't have any data for 2021, and go to the next slide. And this really is for support staff. Again, this is like for cooks, maintenance, secretaries that were not officers that were within the facilities. And you can see that the early part of 2020, we didn't have a lot, but it was until June and July that we had a spike of maybe 2 or 3 here and there, and then another break in August and September. So our support staff pretty much were doing a lot better in not traveling, so that there wasn't the impact there. And I think I did indicate that we did lose 1 correction officer out of the Crown Point district to COVID. So the support staff were not impacted in any way. Next slide, please. So this is a 2021 slide for support staff. And you can see that they seem to be the staff that really took precaution. I don't know if it's because they were the ones that were doing cleaning and they understood the causes of impact a little more. And the other factor that I'm thinking that was happening was that, again, because of the number of limited staff we had, and I had like 2 to 3 per shift at any of the districts. And so they were it seems like they were continuously running throughout the facility to make sure things were working, booking was taking place, all the necessary precautions were happening. And I'm thinking that there was more of an impact on officers just because of the many things that they had to do throughout the facility. So moving forward, next slide. And so what we lost during COVID really was that because of the restrictions that were handed down from the Office of the President, we could not bring any of our resources into the facility. We just stopped all face-to-face training for staff as well as the inmates. All the program came to a halt. So we lost all of that. And they didn't have any visitation as well. And I think this really had an impact to not knowing what was going on in the outside world, as they put it. And then with family, they could have telephone contacts as far as visitation, but they couldn't see their parents, their children, their wives. So I imagine that there was a high impact of attributors because they just didn't have any outside income contact, sorry. And then all court hearings were done virtually. And, and so like across the country, our entire criminal justice system seemed to come to a halt when COVID hit, and a lot of restrictions. And if you were watching the Navajo Nation throughout that process, there was a lot of just a lot of restrictions for us. We couldn't do anything. We basically almost were quarantined to our homes when we weren't working. So next slide. So here it shows a group of our inmates that had classes by video. We stopped all of that as well because we couldn't bring our inmates together in one location. They could come together if they were situated in a pod with the same group of individuals during the entire period, but we didn't bring any new people into the facility. So next slide. And again, this is something that one of the service areas where we do sweat lodge at least once or twice a week. And this is the inmate. It shows them setting up the sweat lodge. We can even do this, even though the one person coming in to do the sweat ceremony, we can even let them into the facility. So next slide. And this is our inmates setting up a tent for a public event. They couldn't do any of this. And oftentimes some of the things we found was that these were the best times for our inmate population, was to be able to get out into the community under supervision, of course, to do public events. Next slide. Here again is another activity that they were dealing with. And I believe here they're filling up a hole. I'm not exactly sure what was going on there, but you know, things like this, they were taken out to the community to do certain projects. Next slide. And here's graduation in one scenario that we couldn't even do everything we put a stop to. And this is really important when we do programming, is that they obtain certificates in certain areas so that if they're looking for jobs, they can use this information to support themselves as they do their resumes and so forth. And we couldn't do any of that. Next page, next slide. And here again is another community project that we usually involve our inmates to do certain things. And what we have on display there is just a lot of different things that we were doing with the inmate population within the facilities, and the public can come in to see what their relatives or loved ones are doing while they are in our facilities. Next slide. And so here I listed the capacities of each of the locations that we have, and Window Rock, which is located in our central headquarters, became a temporary facility. So if a police officer did an arrest, then we could hold them for a few hours until we could transport them out to either Tuba City or Kayenta. In the same way with Shiprock. So Window Rock was feeding into Crown Point, Chinle, and sometimes Kayenta, depending on the classification and so forth. And one of the things that we had to, transports took longer for us. A regular transport between Window Rock to Tuba City is about 3.5 to 4 hours to get them ready for the transport, go across the Navajo and Hopi reservations into Tuba City. Then, of course, there's the transfer of custody, paperwork, and so forth, and that needs to occur. So an officer is off from the facility for about 8 hours. And doing this because there's a lot of that transfer occurring, obviously there's a lot of opportunity for COVID to happen. And so even with paperwork, how we handle that was very important. The gowns, the shackles, anything that went with the transport, we had to clean as we transferred custody to the next district. So, and then going for, next slide, please. And this again was always a favorite for students to learn about the correctional system. We couldn't even do any of this. And this is also educating on hopefully to do recruitment. As I said, you know, we struggle with recruiting correctional officers, getting them trained, and then we lose them to local or surrounding agencies because of the benefits oftentimes is much better than what it is for our nation. So this is really important, this type of activity for us. And then it also serves as a deterrent, and we couldn't do this for 2.5 years. And here again, the next slide. Here again is a continuation of our officers doing a community activity with the students, taking a tour and seeing what all goes on within a correctional facility. Next slide. Here, again, in the same tour, just some education and learning happening. And we found a lot of enthusiasm from our youth when we did this type of community interaction and presentation. Next slide. And so, and a lot of the services stopped any referrals for AA and individual and group counseling, the sweat lodge services, the gardening. We had a gardening project in Tuba and also in Kayenta. Those came to a halt. And of course, you know, these are opportunities where our inmate population get to go outside and do some of these projects. And then the young fathers for parenting, faith-based, you know, doing AA and so forth. All of that came to a halt. And we, in some situations, in Tuba City particularly, there was a lot of individuals who had interests in doing some college courses, doing AA, those types of work with the inmate population. Next slide. So those again are just continued services that we have been, we were providing until COVID hit. And then next slide. This again is another public event. At the conclusion, a picture with the fire department, Navajo police, and the corrections staff, some of the community outreaches that we had to put a stop to. Next slide. And this is a picture of our Tuba City staff, and then also, next slide. And this is our quarterly inspections. And so you can see that there was so much that was lost to us as a nation serving our inmate population. And for most of you who don't know, a lot of the population that we have in our facilities are individuals who've been charged with misdemeanors. So a lot of the major crimes, the felonies, those are all handled by, or individuals are sent to the county detention facilities, on to state prisons and other locations. So the population we serve, again, the larger portion of our population are public intoxication and a lot of the repeaters. So a lot of the individuals that come into our system, the officers already know who they are and continue to work with these individuals. And so a lot of the impacts of this was that a lot of the individuals who are repeaters are basically homeless. They've been out on the streets for many reasons, because they're substance abusers. Sometimes families don't want them home, so they become homeless. And often this is the population that we're getting in our facilities as well. One of the other things that I want to also point out that I don't have in my PowerPoint is that because about mid-2020, the COVID seemed to be just surging on the Navajo Nation. And one of the things that our president wanted to do was for those individuals who did not obey the quarantine and isolation criteria under COVID, at one point, I was afraid that there might be an executive order or whatever for us to house these individuals. And we had to, I had to educate and lobby that this is not the best thing for the nation to do. So that in itself, of course, was a real struggle to get through. The idea was that if these people didn't listen, then let's put them in jail. The same, this came from the Navajo Police Department as well, is that, this guy's always out drinking. I've had to interview, or I've had to arrest them several times. Please keep them in facilities. Don't release them. We don't want to walk in the streets. And it really translated to indirectly as a department being asked to hold individuals in detention against their will, and realizing that, yes, COVID was dangerous. The spread was rapid, and a lot of blame was placed on individuals who were repeat offenders. But thankfully, the nation was able to just set up alternative sites, like at hotels. They had tents, I believe, in Chinle, and then some of the bordering towns, they were able to set up so that these individuals could be sent there. Again, like Yavapai County stated, our entire justice system came to a halt. So the individuals from the front end who we didn't release because of the health conditions, we kept through most of the quarantine, the period, the last 2 years, while they served their sentence out. So we had about a little under 200 all the time who were serving, and then the rest were coming in, and we turned them around at booking. They may have stayed for a little bit and then they went home. We didn't lose anybody as far as the inmate population due to COVID within our facilities. So we're very thankful to that. And I stand for questions. Thank you.
Thank you so much, Dr. Gray Eyes. That was fantastic. I really learned a lot. And I assume everyone else did too. So I think we'll pause for questions for our question and answer panel and give everyone about a 20-minute break.
Yeah.
So all right. So as people kind of come back in, I'd love for all the panelists to join us. If you want to put on your camera, that'd be great. I'm going to share my screen quickly because we have one panelist who didn't give a presentation. Whoops, that's not what I meant to do. And I'm so glad to introduce Commander Figueroa, who really has been amazingly supportive of the research our group at NAU has done. I really like working with him, and I'm thrilled that he wanted to join us for this panel. Commander Figueroa has a Bachelor's of Science in Criminal Justice from Northern Arizona University, the right one, and graduated from the National Jail Command Academy and the Leadership in Police Organizations program. He has been the commander of the detention services since 2014, with over 25 years of experience in detention services. As detention commander, Matt Figueroa has been actively involved in interagency programs that aim to improve criminal justice systems and processes, and works closely with other members of our Coconino County Criminal Justice Coordinating Council to take measured approaches to better understand jail populations and the forces that affect them. Welcome, Commander Figueroa. I'm going to stop sharing my screen and say thank you for joining us.
Thank you for having me. First off, can you hear me?
Yes, great.
Okay, good. I've had nothing but technical difficulties all morning. I'm using my phone for this Zoom. For some reason, today was the day that my computer in my office decided that they did not want to do Zoom anymore and they wanted to go back in person. So I'm on my phone, and again, glad to be here, glad to answer any questions. And if needed, share the similar situation and issues we faced, just as Yavapai did as well. So again, thank you for having me.
So I'll kind of orient our audience. We have a couple of questions that we have planned for our awesome panel. But also would love the chat is now open for anyone who has additional questions that we will definitely take. So if you have a question, please throw it in the chat. But I think what we'll start with is, I actually have a question and we'll start with the COVID prison project. So Megan and Catherine, I'd love to hear, and you touched on this quite a bit, but I'd love to, if you have anything to expand on about collaborating with correctional facilities and other community partners, like our partners here on this panel, and are there any plans to expand those community partnerships?
Yeah, so it's been, I think working with correctional partners, and I'm sure the correctional partners on the phone can attest to this, right? It takes a lot of trust and a lot of time to be able to develop really trusting working relationships, right? One of the jails that I'm working with here in South Florida on the Radix project, we needed to have a mutual understanding of what our goals were, right? And that we're both ultimately care about mitigating COVID-19, that we aren't there as outside researchers to do some sort of expose on the jail or, talk about, frame necessarily the jail in a negative light, right? That we're coming in as scientists and wanting to know, what are best practices, what worked, what didn't work, right? How can using their jail, their site as a case study help other jails, right? And I think, in my mind, that's really brave of them and really great of them, right? To be able to be open to those kinds of collaborations. But, it does take a lot of work, as I mentioned, to build partnerships. It's a lot of phone calls, a lot of meetings. It sounds like you all have a great partnership. And so that's always, that's like wonderful to see, right? Others who are able to do that. And, we are, we have been, you asked about, are we looking to expand partners? And I will say over the course of the pandemic, our partners have changed over time. We originally, there was 3 state prison systems that we were going to collaborate with and had buy-in from, high up leadership, as well as, the governor's office and so forth. And then, once we got the grant, they decided they didn't want to be involved for various reasons, right? And so we went through it, which, I'm not going to get into, but, like stuff happens, right? These are political decisions. Correctional facilities are operated by ultimately governments, right? And there's a lot of political concerns. There's a lot of other concerns. And so we reached out to our networks and just sort of organically, asked who would be interested in partnering. And we have some really great partnerships, as I mentioned, from both prisons, entire prison systems, but also a number of local county jails. And so I think it's been a really great process. It's been a learning process. There is, as people on this call are probably aware, and as I kind of mentioned in my talk, there's so much bureaucracy when you get county lawyers involved, university lawyers involved, contracts, MOUs, data use agreements, HIPAA agreements. A lot goes into these. And, I'm really grateful that I've been able to develop the relationships that I have with the partners that we're working with. And, I'm really hopeful that, that we're going to be able to, I think as Bea was mentioning, right, like we're going to be able to put out some really high impact reports, based on our community partners that we're working with in terms of what worked in the pandemic, what didn't work, what are maybe best practices for like certain kinds of facilities or certain kinds of counties, and so forth. So we are, if there's other partners, including ones on this call that would be interested in joining the Radix team and contributing data, to our modeling efforts, we are definitely open to that. And, please feel free to reach out. Thank you, Ricky.
Yeah, that's a great answer, Catherine. I would add as well for COVID prison projects specifically, it was really essential for us to maintain open lines of communications with Department of Corrections, often for clarifying different metrics that we were capturing. So for example, when we were doing data extraction, being able to ask, what does this mean? What population is included here? As well as for some of our vaccination reporting early on, we contacted medical directors at departments of correction directly to ask about numbers of vaccines that were being administered. So having those contacts available and being open to share data with us was really essential for getting real-time information.
Thank you. That is, I know how much work goes into those partnerships, and I think Catherine really said the magic word, trust. So thank you for sharing those experiences. So I would like to reach a question out to Coconino, Yavapai, and Navajo Nation, so our partners there. How can researchers and research institutions support correctional facilities through the rest of the pandemic and potentially future outbreaks? That COVID-19 wasn't the first, it won't be the last. Just to kind of give us an idea, maybe, what kind of support, maybe Catherine and Megan, with their work can also do that. So maybe we can start with Commander Figueroa at Coconino County to put you on the spot.
I know that's okay. The good thing is our partnership with NAU and some of the other projects that we've been able to work on in regards to taking our data from within the facility or taking just all the different population points that we have and working on projects as we go. I think the biggest thing and the support necessary is having those relationships, having the confidence and the trust that, the idea behind the sharing of the information and the data is to try to find solutions to any kind of issue that we may be having. It just happens that we're dealing with COVID right now. The good thing with us is that, we have protocols that have already been established for any type of communicable disease. So this was just a new one that we added to it, and the extent of how either vulnerable that our population and our staff were to it, or how.
I think you were muted somehow, Commander Figueroa.
That's so weird. I didn't touch nothing, I swear. Again, it's that technical difficulty, but just to reiterate, just having those established trusts and partnerships, with this being a new virus and a new approach to how we had to deal with it, taking lessons learned, being able to share the information that we were putting out, and helping with these statistical departments, or specifically NAU, to see what we can do to put some additional measures in place for when we are faced with another pandemic. But for us, it's always just being open, having that transparency, and having the trust that, again, our partners that we're trying to work with data and statistics, it's always to find that good solution to the problem that we're facing.
Oh, wise words. Thank you. That covers so much. Maybe we can go with Captain Martin and Bea Thayer next.
Yeah, so I'd just like to really just emphasize what Commander Figueroa was saying, developing those relationships prior to the pandemic and having that trust built up, so that we understand each other's true goals and meanings behind everything. Law enforcement isn't particularly trusting of outside sources all the time, and so building those relationships in advance and having that there is huge. And really, I don't know that we would have been able to work as closely as we have with our partners if those relationships hadn't been built prior to the pandemic.
I think it would be great so just so that everybody knows that the Reach Out program and the coordinated reentry program that we have here at Yavapai, NAU Center for Health Equity Research, and Ricky and her team, they have been doing our data analysis and evaluation on this since the beginning of putting that together. And I would love, and this is like yours and Carly's and everybody else's brain to figure out what it is that I'm trying to say. But if you have like Captain Martin's data that talks about the differences in lengths of stay pre, during, and then kind of a little bit post-pandemic, and then our data, you just got that new set and the next set that's going to come up as well about people who are part of the screening that we've done, and when they come back to jail and why they come back to jail. Like, how does all of that correlate? Because the folks who have stayed longer, or what they've missed, I'm just trying to think, like, if somehow you guys can figure out with all of your outside eyes and what we give you to come up with, did we do something that actually made a positive difference? Or the next time we get slapped with some crazy, very spreadable disease, can we already have some ideas in place about how we can bridge those connections with these individuals and makes longer lasting service connections, so that people aren't recidivating? Like, and maybe there's something, of course, more you guys can look at besides just what happens in inmate programs, but what happens with, like we were talking about video initial appearance, which is really great, but then we have another step of early disposition court for people who commit felonies, and that's usually 10 to 14 days out. And if they're not seeing anybody in person, does that seem to make a difference? Yeah, and like Captain Martin said, we trust you to be able to do that, right? Like you've been walking this walk with us for 4 years. And so what is it that we need to, what do you see would be really helpful as a researcher that could support a county government in supporting this population?
Well, you said a lot of nice things about us. Thank you. Yeah, I think you bring up some incredible points. The outside perspective is, sometimes helpful. Trusted partnerships. We hope to, I know how hard Yavapai County and Coconino County on their own programs to have worked to make these programs successful and impactful, and, making sure that they work. And we're just here to help show off the good stuff you're doing. Really, that's our job. Dr. Gray Eyes, would you like to weigh in on how maybe researchers can kind of help with, the COVID-19, other health problems on Navajo Nation?
Well, thank you again, Ricky. And that's a big question you asked me, so I'm going to respond big. No. Navajo Nation, obviously, as large as it is, in many of its programs, including corrections, is really still, I would say, at its infancy. And as far as any resource support from anywhere, and just to cite an example, $700,000 a year from the Navajo Nation to support this program. It's nothing. And much of the funding comes from BIA. And so I think that in order to build this, it's going to require a lot of education. Many of our tribal leaders don't understand the concept of jail, detention, corrections. And I think that the research arm of it would be to get help from an agency like yourself to take a look at our data and do some analysis, and for myself as an administrator to utilize that. I guess the question could be asked, well, you have a PhD, you know how to research. The problem is there's only 4 of us that's running the entire, 4 including me, the entire Navajo Nation Department of Corrections. And funding is very difficult to be had. And a lot of the research piece and data analysis really would help us all the way to the DC level, because 99.99% of our funding comes from the BIA, and it's very limited. This year, I'm renewing my 5-year contract, and obviously, I'm going to be looking at my data and hopefully using that to further the department. And so when a pandemic hits like this, it's like no resources, absolutely. So I think partnering up with a research arm obviously would be very helpful for my department in development and so forth. And so thank you. That's my comment.
It's a great one. I think Carly has probably a lot to say about this. This is her passion.
Right.
So definitely we'll be contacting later. We do have another question in the chat, and it looks like Captain Martin's answered a little bit, but it's for Coconino County, Yavapai County, and Navajo Nation. Did anyone have to deal with mitigating community concerns about changes in releases or types of offenses being booked due to the COVID spread or concerns, even if it's founded on misunderstandings?
This is Dr. Gray Eyes, and I think I kind of touched on that just a little bit, where the president of our nation and the Navajo Police Department pondered or requested that we house anybody that was positive, COVID positive, and particularly when the public reported them out in the community, they wanted to put them in our facilities and we would have to house them. Well, there's the other issue of the legality of doing this, and it just took a lot of work to tell my tribal government that's not the way to go. And I think that's really important. And I think I'm not sure if a lot of tribal communities deal with this. It's like, okay, we have a lockdown facility. If you can't obey this, then this is what we're going to do, without the legality of it being supported for us to house anyone just because they're COVID positive. That's my input.
Yeah.
Commander Figueroa, do you have anything to add?
Yes, and for me, it comes back to that whole transparency again. When the pandemic first started, we did reach out to courts and arresting agencies and explained what we were trying to do and to mitigate the virus from coming inside the facility. We knew we would eventually get it, but it was how bad will we get it and what can we do to keep it from mass spreading throughout the facility. So a lot of communication was had with the courts. We explained our situation. Ultimately, it's the court's decision whether somebody is released from our custody or not. There was always that confusion from the community at the very beginning that the jail gets to decide who stays and who doesn't, and we never get to decide that. All we can do is share information and explain why we need the population to be at a certain level and what we're trying to do to quarantine and isolate while we go through this. So, one of the things that we did was we constantly put media releases out whenever we either implemented COVID protocols or there was any change, or if we just wanted to give the public an update about COVID inside the facility. We put that out there, and we put that out there constantly. So if there was speculation, if there was confusion, if there was concerns, the community could either go to those media releases, or if we did get those questions internally, we were able to answer those and explain, what was really going on inside the facility regarding COVID. So a lot of it was just clearing up and being open to put that information out there so that there wasn't this misconception or who was being released. We were once we had releases put forth by the courts, we were very clear on what those type of releases were and what charges were being considered for release, so that the community would still feel that sense of safety, that we weren't just opening up the doors and letting everybody out for fear of COVID. So that was one of the things we did, yeah.
Captain Martin or Bea, would you like to elaborate on what was said in the chat at all?
Just that there's, we didn't really, we did get a lot of pressure from our community members and our law enforcement partners when we stopped taking the misdemeanor bookings, the ones that were just statutorily required. You would think that the community would, really understand that a little bit more. However, that wasn't our experience. A lot of times they're, this nuisance misdemeanor booking is their, it means a lot to them to get this problem resolved. And our law enforcement partners telling the community members, hey, look, I can't do anything with this drunken, disorderly person because the jail's not accepting misdemeanors right now. and they were, they passed that information along. And so we would get some pressure from the community to reopen, those misdemeanor bookings. And we're actually in the process of coming up with that system now, where we're going to start accepting those again. The other parts of that were, we really didn't, there wasn't any silver linings really to speak of in shutting down our programs that resolved there. We really missed those. I think they were very beneficial in keeping people moving through the system. And if anything, it's been very dark times in regards to those. The one silver lining has been the technology side of it, and establishing new video court procedures. That has really reduced the amount of inmate movement that we've had to do. And that if there's a silver lining in any of this, it's the technology side of it and coming up with new systems to deal with that.
I'd love for we're just going to go off my script because you all are asking way better questions than I had planned. I'd love Taylor to ask her question about, kind of following up with Captain Martin and about the programming, because I think that is so important. But before you ask, I hope you don't mind if I cut in line for a second and ask Catherine and Megan, if I know that there's some policy stuff you've looked at in the COVID prison project. Has that been a big, I imagine that's 100% across the board, but I'd love to hear what you have to say about programming and in the work that you've been looking at. And then I'd love to hear, have Taylor ask her question.
Yeah, thank you for asking about some of our policy tracking projects. So we, similar to the COVID prison project, which was really focused on quantitative data surrounding the spread of COVID-19, we also collected for all 50 state systems and the Bureau of Prisons, ICE, and Puerto Rico, and a number of 50 local jails, the largest ones in the United States. We did regular combing on policies. So those included testing. So for example, like different types of testing, if places were doing serial testing, symptomatic testing, as well as really just tracking over time visitation policies, mask policies, divided out by both staff and people who are incarcerated. So we do have that policy data available. And again, everything that we collect is entirely open source. So Catherine and I would be happy to share that if folks are interested.
Yeah, and I'll just add, and I'm curious to hear from the people who work in corrections on this call. That's one of the things that I've been thinking a lot about, and that I think this may impact people who are in prisons more than jails, just because they're there for such a long time. But yes, all Department of Corrections basically effectively shuts down programming in terms of educational programming. I have a colleague who's a clinical psychologist that runs trauma therapy groups, and she wasn't able to meet with her patients, right? And so we think about all of these services, and I think, Bea had made the point earlier, right, that for a lot of people, their entry into services is through jails or prisons, right? And so having all of those shut down, I'm wondering about what the long-term consequence of that's going to be, right? For not having substance abuse treatment or mental health treatment or, GED classes, right? All of these programs that are normally provided in correctional settings to help people. And if, even when the pandemic's over, right, are we still going to be dealing with these kind of longer term mental health, or educational consequences from lack of programming? And, it makes sense that programming got shut down from a pandemic perspective, right? But there's always like these unintended consequences, just like we saw in the community population of unintended consequences of stay-at-home orders, potentially increasing domestic violence, right? There's always these kind of trade-offs. And so I'm curious, so that's one of the things we've been tracking in particular is like, when are people slowly bringing back education, or, have they tried to adapt in certain ways? And so I'd love to hear from the people on the call, like Captain Martin and others, about, if they have any thoughts on, if there's going to be these potential long-term consequences that we're still going to see years from now from this lack of programming for people.
I could jump in really quickly. So on the silver lining part, 2 years ago, this format would have made us all crazy, right? This would have been so hard and so difficult. And yes, we're all at this point, right, of like, hey, there's a 4-day conference coming up and it could be virtual. And I'm like, no more, no. But we could do 3.5 hours. We've got this down, right? And so things that have popped up, I think, on the outside world, not within the jails, but on the outside world, that will be sticking around, and we're figuring out how to navigate. Like I said, telehealth is ginormous. Our state passed legislation that said telehealth can be billed differently and it could be used more. And, you know, there's some to contact a local therapist to work with a teenage child on a regular basis, especially if the person doesn't have Medicaid and they might have private pay. There's a wait out the door, right? Like we've all gotten slammed. People are needing to take breaks from some of those professions. And so now, like, there's all these new ways of connecting and being able to do groups. And I just heard about a new, somewhat new behavioral health service that has always been online, and they're able to connect a teenager who is transgendered and thought that he was the only person in the whole world like this because he lives like on a tribal land with a group of kids from all over the place, and how fabulous that has turned out to be. So yes, we need to bring the programming back into the jail, and it needs to be face-to-face, and we have plans for doing this, and it'll come back and it'll be better than ever. But if you have 6,000 to 7,000 people being booked every single year and a daily population of over 500 people, not all those individuals would ever be receiving face-to-face ongoing programming. So this whole tablet thing, right, that now we're giving inmates tablets and they have access to tablets, and I think they can play games on it and they can email with it, but we're able to add information, and we're stocking up that information. So we now have this mental health curriculum on there that's self-paced, and you can send in like your answers and get a certificate printed and show it to your judge. Like, hey, I've made it through module 4 of 10, right? Like we can get someplace there that way. And we want to continue to add pieces like that. We have one of our strongest partners through Trauma Lens Care, and she is creating, actually, it's the same thing kind of as a Canvas platform, but different so that you can't link to the outside world. But then she'll be able to reply to them in real time, and she's going to start building up parenting classes. And I feel that this platform will be able to actually reach additional people. I don't think that it replaces the great one-on-one programming, but it can help reach additional people and help making those connections as folks are getting out of jail and into society. And we're hearing more and more and meeting with more tech companies that work with community connections, like community corrections, sorry, so that they're having people who are on probation use their phones to do more check-ins on the kind of probation parole side that even has to do with drug testing, and using like DNA drug testing instead of having to drive, and you saw the map, all to these far different places and go to like a facility that might not make you feel good about yourself, and have somebody watch you as you do your drug tests and turn it in. So there's this way you can do it from home, and you can mail it in, and you can have quick little texting, because you know more and more generations now are liking the texting piece instead of liking the face-to-face piece. So those, I think that's where our silver lining is not to take it all away, but once you open a door like we're doing here now and having a conversation with people from across the country in different disciplines, we can just keep tapping into that.
Commander Figueroa, this might also be a good chance to maybe talk a little bit about some of the impacts that you've seen at the Coconino County Detention Facility, by also kind of talking about the programming and how that's impacted, and if there is any silver lining at the end of this pandemic.
Oh, so for me and for the Coconino County facility, there are several silver linings that has happened because of COVID. And I have a lot of information to try to address all of this. So please cut me off whenever we want to move on to the next. But, you know, here at Coconino, we were always huge advocates of trying to do more court hearings through video. We knew per court's criminal rules of procedure that there was a lot more hearings we could have been doing by video. And for years, I spent trying to advocate that and try to make the courts understand why it's a valuable resource and what that potentially does to limit safety and security when we're driving our inmate population all over town and getting to the courthouse for all these different type of hearings. And COVID forced the courts to do it. And I think at the end of the day, we saw some big successes. We were able to streamline more type of hearings because we did it through video. And right now we're in constant discussions, and my hopes is that we're going to continue doing more hearings for those that are in custody through video, one, to help speed up the adjudication process, and two, to just add an additional layer of safety and security by not having to transport so many people out of the jail just to go downtown for a court hearing. When it comes to programming, you know, we shut down programming just like everybody else did. And the biggest thing that we constantly said with our community is we will continue to follow CDC guidelines and recommendations. And we're not going to go in an opposite direction, or we're not going to start to open back up and do things the way we used to if that's not the recommendation coming from the CDC. And I think a lot of people, one, were, you know, once they realized, you know, that's why we shut down programming, is we didn't want to force our inmate population to come together into our program rooms to continue all the different type of programs that we had. And because there's that huge liability that if we were not taking COVID precautions seriously and we were going back to business as usual, we knew at some point we would have some type of mass outbreak of COVID, and that potential for liability if something did happen with any of our inmates because of the COVID virus, and because we were basically purposely putting people into the potential to come into contact with that. So that was a constant thing that we continued to talk about. You know, we had all different parts of the criminal justice system that was constantly telling us, when are you going to start your Exodus program, your 90-day substance abuse program back up? It's a huge benefit. Some of the comments that we got was, you know, that's why we send people to jail, so that they can get the treatment and the services that you guys provide, because there's nothing like that out there anywhere else for them to get. To me, that is a huge disservice of why we put people in jail, in order to get proper programming or substance abuse treatment or proper medical care. That should not be any reason why we put people in jail. We should have those systems in place for those that unfortunately end up in our facility, but we definitely should not be trying to get people into the facility in order to get that type of treatment. So that was one of the things that we kept trying to reiterate back out to the community and to our criminal justice partners. You know, we didn't have to shut down taking misdemeanor arrests until a few months ago. We were able to continue to talk with the courts and talk with the arresting agencies to say, look, if it's a non-serious offense, we ask that you find an alternative instead of bringing those individuals to jail, so that we can keep our population down to the necessary level to adequately follow CDC guidelines when it comes to quarantine. And we follow that today because, again, the CDC hasn't necessarily changed anything in regards to congregate settings, which jails are, even though the community and the people might be opening back up and masks are going away and people are starting to come back together. It's going to be a slow process for congregate settings, because again, once the virus gets in and we're not taking any precautions, then it's going to spread like wildfire. And fortunately for us, we were able to contain it and mitigate it. And we only, as of today, we've only sent 3 people out of our facility for additional symptoms that they were having that we weren't able to properly care for while they were in jail. And that was temporary. And then we were able to get them right back into the facility. Again, because of the efforts that we put into place. And unfortunately, that meant shutting down programming. You know, one of the things that I also say too is when we feel better and we're coming back together and we're meeting in person and we're not doing these virtual meetings anymore and we're not using Zoom, then that's the time that we'll start to consider bringing programming back. You know, some of the issues that I had was we had people in virtual meetings telling us, you need to bring it back, you need to do it. Yet we're not comfortable being back together and physically meeting because of the virus. So why would we want to put our inmate population in that potential risk if we're not willing to do it ourselves? And a lot of that finally hit home with a lot of people that kept asking us. And then also too, with the way we were able to keep our population down and still have it down as of today, some of the individuals that were in our facility constantly that would benefit from our programming are not in our facility right now. So even if we did say, you know, tomorrow we're going to start Exodus again, and we're going to start our substance abuse 90-day in custody program, we don't necessarily have the inmates that are eligible to even participate in that program right now because they're not in custody, which is good. You know, I think what COVID did is it made our community and it made our justice system realize maybe some of the people we had in jail didn't have to be in jail in the first place. And maybe we need to be coming up with other alternatives so that we're not relying on jail systems to have, you know, the best mental health facilities there are in our counties, have all these great programs for individuals that are justice involved. Maybe we need to start looking within our counties and within our communities and start establishing those type of programs outside of the jail so that we have some alternatives so people don't have to come to us in order to get that programming. So again, I can speak for days on this, and I do see a lot of benefits that we did get out of with this unfortunate pandemic. And you know, just as of right now, we're not comfortable opening back up the facility and starting programming back up because, you know, we still don't know yet. And again, if the CDC isn't comfortable with changing their recommendations, then there shouldn't be an outcry for us to change ours as well until we have a plan in place and we have some further recommendations and guidelines that we can use to have a safe reopening. And I'll stop there.
See, I told you all that this is a cool group at the beginning, and I stand by that. So thank you, Commander Figueroa. That was really enlightening. I'll ask if Dr. Gray Eyes, if you want to answer that question about programming as well and follow the rest of this group, because I think this is a very important conversation to have.
And thank you. I personally believe that there is a huge impact because just the complaints, the behavior that we got from individuals that were serving time that couldn't get any programming was something that we had to deal with. But also on the long term, I imagine that when they do eventually get released, they really wouldn't have a lot of takeaway as far as programming. But we also started working on just the telehealth, being able to, and COVID has done this, is that we had to look at ways of setting up MOUs so that telehealth healthcare can come to the population without us traveling. Now, we need to extend this on to the courts. Unfortunately, we do have tribal laws in place where the only time that an inmate or an arrestee can come before the court virtually is on their initial arraignment. any other hearings, I understand, or at least the public defenders push to have inmates physically come before the court. So we have some work to do there, but I really appreciate the discussion from Coconino County and their programming that they're doing. Obviously, I have an interest in learning from you how your resources of iPads and so forth were purchased in order to make this happen. And I'm sitting here, we're going in to council, had to have some of the changes in laws, and possibly this could be a funding mechanism that we could maybe seek. But I think as far as just shutting down programming in its totality will have an impact. What it will mean probably is that we'll be releasing people without any programming services that they should have gotten while they were here. And possibly mean they'll be coming back to see us in a year or so or less. So the revolving door concept. So the other piece that's really important to our Navajo people is the traditional aspects, the sweat lot ceremony, where they can have the individual one-on-one with a medicine man. That's really important. And I know that in some situations, medicine people have been able to provide that service. Now, what I'm looking at is bringing that into our system to allow that service to happen. So, so there's some silver linings I'm looking at. And then, of course, I'm going to see impacts into the future as a result of the limitation of the programming. And I'm learning a lot. I really appreciate this discussion and hope to capitalize on some. Thank you.
Dr. Gray Eyes, maybe we can connect down the road in a week or two. I do have some potential funding for iPads and technology in tribal facilities through the Department of Justice and through the VA. So I'll connect with you about that soon.
Thank you. Thank you.
I love coming together. I think we all can learn from. I've learned so much today. I knew I would, but it's still a really nice feeling. So I don't see it. Actually, there was one question, and I don't know if Corey Hemstreet, who is awesome, if you wanted to ask your question. I do think Dr. Gray Eyes answered it, but I'm not sure if. Can you you don't have to come on, no pressure. I don't know if she's still on. Actually, I don't. She might not still be on.
Is that on the testing kits?
Yes.
Yeah, we were fortunate that the nation did get a lot of CARES money. And so they were able to order test kits for us that we use throughout the process. We're still testing. And then we also received some kits from the Indian Health Services as well. So we didn't have to pay for any of those test kits. And then, of course, our staff were trained to administer those kits as well. So which was good, real helpful.
We're playing an unmute game.
I'm sorry.
No, go ahead.
I was just going to say, I know that question was specifically directed to Dr. Gray Eyes, but I know that the RADx and other types of funding mechanisms have helped not just incarcerated, I guess just one project with incarcerated folks, but across the nation to get to different types of testing to different types of communities. Does anybody have any else to add about that, or if they've had limitations or are fortunate enough to have been easily able to find those things?
Yavapai recently bought 2 PCR tests, and I'm gonna have to have Captain tell me what fund we use to pay for those. And then Health Choice Arizona, so that's our Medicaid health plan, they gave us money to buy the actual tests. I don't know if it's all gotten here in one package for us to be able to test anybody yet, but Rich, how do we pay for the PCR machines?
Salary savings.
Okay.
I've got a lot of vacancies right now, so salary savings isn't a problem.
I think we're on a theme of silver linings here. Commander Figueroa?
Yeah, I'll chime in for Coconino County, and this would be a good time to be able to explain what we have too. And I just want to say, we've had a great experience, you could say, and our partnership with our Health and Human Services Department. We have never had an issue with tests and getting tests and having those available. And I think part of that is the relationship we have with health. I know with our meetings with all of the commanders throughout the state, there were some counties that didn't have that relationship with their health department, and they had no help to be able to get tests, and them having to navigate and figure out ways to be able to get the tests. We never experienced that. Even as of today, we still get the necessary tests we needed. Part of that is, of course, we do all our own in-house testing with our medical staff. We became an actual pod or a site for the state when it came to getting the vaccination. So we get them directly. We don't need to go through a third party to be able to get vaccinations. We went through the process for our medical staff to be able to be part of the group and consider our in-house medical unit an actual state pod to be able to get that. And part of it was, again, our constant communication with our health department and us constantly staffing those individuals that were positive with COVID, whether that was our staff or our inmate population, so that we were able to keep that tracking and making sure that we saw everybody getting the necessary medical help that they needed to get through COVID. And like I said, we had several officers that have been positive for COVID and our inmate population as well. But we were able to quickly get individuals tested and having results. Another partnership was with TGen, of course, who our tests go to for Northern Arizona, and constantly communicating with them. We could get individuals, whether it's staff or inmates, tested in the morning, and we would have results back by the evening. So that was very helpful for us to be able to get individuals either moved into general population because they finished their quarantine, or getting them isolated if while they were in quarantine, they did end up testing positive. And for our staff, that meant, the quicker we can get them tested, the quicker we can get the results, the quicker they could be home, go through the necessary number of days to get through the virus, and making sure there was no other medical complications that came with that, and get them right back to work. Because that was also our concern, was having a mass exodus of staff out with COVID and how we were going to be able to safely continue to operate the facility. But we were able, again, with those partnerships, to be able to get both our inmates and our staff tested, getting the results in, and then going through whatever treatment process we needed to if we did have individuals positive. And the same thing with the vaccination, being able to offer the vaccination. And just like most of the jails, there was huge hesitation on those inmates wanting to receive the vaccination. Unfortunately for us, we experienced a number of individuals that did not want the vaccination because they thought, well, if they get vaccinated, then they're going to be forgotten about, and there's not going to be that concern that they're in jail and they may get COVID. They also thought that there was the possibility that they would be released from jail because I don't have the vaccination and it's not safe for me to be here. But again, because we were able to communicate all the different things that we did to mitigate the virus and to show that we were offering the vaccination to our inmates, they finally came around. And, once individuals started being released, and unfortunately, if they did end up coming back into custody, they were either being vaccinated on the outside, or they were able to continue their vaccination process back in custody if that was the case. So, yeah, that's what I got to say.
I would like to add something if I could, Ricky.
Of course.
Yeah, so I just wanted to comment on a couple of things that Commander Figueroa said. You know, he mentioned that they had a really good relationship with their public health department, but there was other counties, right? And even in Arizona that didn't. And I think that's definitely the trend that we saw, right, nationwide, you know, with different departments that we had contact with, right? If there's varying levels, both at the county and the state level, right? In terms of the integration or the past collaborations on different public health initiatives, you know, those relationships and bridges that are built between public health and correctional health, you know, or, you know, the administration side. And so that's definitely been my impression that the either county jails and state prisons that had better relationships with their public health department got through the pandemic better, which makes total sense, right? You know, and some states have really robust, you know, HIV testing programs through public health, right? You know, already had really integrated programs that made things really seamless when it came, you know, time to like contact tracing or getting testing in the door, or, you know, sharing PPE with correctional staff, right? All of these kinds of things. And so, you know, something I kind of mentioned earlier, right? Which I think, you know, looking ahead to future pandemics or flu outbreaks or, you know, any of these kinds of things, you know, I think having these cross-sector, right, integrations is really important, right? And that's, you know, sort of a good place to start. And I was going to make a second point, and now I totally forgot what it was. So I will think about it and maybe come back later. Yeah.
You know, I'll go ahead and just chime back in real quick and just say, you know, one of the things that we have always advocated and stated whenever the jail and the sheriff has an opportunity to speak about how we run our facility is that just because somebody's in jail doesn't mean that they're no longer a member of our community. This is just another portion of our community. These individuals cannot be forgotten about. We don't let people forget that we have people in jail and that they still need the same services that they would receive if they weren't in jail. And I think that was part of the big success that we had with our partners when it came to COVID testing and vaccination. Was this is just another section of our population that we need to get through testing and the vaccination process and get them the necessary treatment that they deserve. Now they're in jail for whatever reason. You know, the majority of our population is still pending adjudication. So if they're in jail right now, it's because there is a safety concern for that person to be out in our community. But that doesn't mean then they don't get the same services that everybody else is getting. If somebody is not a threat, then they're not in our custody right now, so they're able to continue getting what they need to. So it was just making sure everybody did not forget that we have our community inside this facility, and at the end of the day, they're going to be walking out our doors and going right back into that community. So we need to be helping them as much as we're helping each other if we're not in jail.
Thank you so much. We're coming to the end, so we have about 9 minutes left, and I want to give any of our panelists one last chance to kind of say anything, and then I'll do a little bit of a summary, what I took out from this, and I hope that you'll all just a quick, and I'll repeat it at the end. If you haven't completed the evaluation or clicked on the evaluation link, please do and complete it after this is done. So does anybody want to have some final thoughts before I give mine?
I think at least on COVID Prison Project, a theme that we've continued to run into is really the need for standardization across different systems on how data are being reported. And as well thinking through, you know, some of these recent comments in the panel, also highlighting not just COVID-19 data, but population more generally. So specifically thinking about decarceration as an end goal and having a systematic way to understand how we are actively reducing the incarcerated population. So that's one theme that I would highlight for us.
Yeah, one thing I'll add, and this was my second point I wanted to make based on something Commander Figueroa said, so it'll be a nice place to end, which I think has been brought up by a couple of our speakers, right? You know, this idea of like trust and misinformation. And Commander Figueroa made the point that they had relatively low vaccine uptake, right, among people in their custody. And I think that's something we've observed too. I've observed in my state and other places. And as I've talked to people who have been recently released or, they're on parole now, and you hear the same, as someone described it to me, as it's like it's like the inmate hotline, right? Like information gets spread and then it like spreads through the inmate population like wildfire, And so, I had people tell me like, oh, well, I heard 80,000 people died from the vaccine already, right? Or, I heard there's government trackers, right? All of these same misinformation things that we hear about in the community are like also present in these facilities and are likely even more heightened, right? And so, when we think about, so I think that was, a good point in thinking about like, it's great to have vaccines, but if people aren't going to take them, right, that's, that's a huge barrier. And so, just kind of considering these, kind of educational messages, right, along with, vaccine uptake and just recognizing that, as Commander Figueroa said, right, these are people too, they're people in our community, they're subject to the same misinformation and they're subject to the same stuff that everyone else is on the outside, right? And so I just wanted to end there, and I wanted to, say thank you so much to everyone on this panel. I really enjoyed it, and I learned a lot from you all as well. And I think, to focus on the silver linings, to what everyone else says, I think kind of the changes and having more video. Video court, having greater access to telehealth, maybe having greater diversion programs, all of these things ultimately are going to be like a net benefit of this COVID-19 pandemic. And I hope are things that, will continue to be developed and will be around into the future. So thank you, everyone.
This is Dr. Gray Eyes. I just want to say thank you as well for having been invited to this panel. And I like I said, Navajo is still very much in its infancy stages and many of program developing. And unfortunately, I had to start out by bringing online new facilities that actually could support programming rather than just kind of warehousing. And so having said that, I'd like to reach out to our Commander Figueroa and to see some of the programmings that you are doing and just kind of maybe see what we can do to make changes. But obviously, we're starting out with telehealth using Zoom, and we want to be able to reach out and do some of the behavioral health in that manner as well. So I just want to say thank you. I learned a lot and I appreciate you all.
So for Coconino, I'll go ahead and chime in, and absolutely, we'd be more than happy to share any information and any thoughts on the programming that we provide or the systems that we have in place to anybody. That's one of the things I think that make our jails in Arizona so successful, is because we're willing to share information and talk to each other. And so we welcome additional detention facilities or correctional facilities to reach out to us and see, even what they may be doing that we can learn from, and vice versa. I'd be completely open to that. And just again, to say thank you for my invite to be able to participate in this. It's I think for Coconino County and dealing with COVID, specific to those that are in our facility, one of our biggest successes is just how transparent we were. As soon as we started getting any kind of complaints or misinformation, along with our media releases, we really made sure that we addressed those statements or concerns immediate, whether that was through or with the internal criminal justice system, or if it was just our community specific. And again, just having that openness to be able to explain what we do inside our facility to operate a safe and humane and good place. Unfortunate for those that end up in our jail, for those that are not pending adjudication, that are actually in our facility doing a sentence that they may have been convicted of. Our biggest thing that we try to tell people is you come to jail and that's your punishment. You don't come to jail to be punished. So that's what we stick to. That's what we try to emphasize with our officers and our staff that work inside the facility. So at the end of the day, these people are our community members, brothers and sisters that work and are in our community. So we need to treat them with the same respect as we would with anybody else. And I'll leave it at that. And again, thank you for having me.
There were a few themes that I heard, and a lot of it was trust. I love Taylor bringing up silver lining. We found that there are some things moving forward due to the pandemic that are good. I think something that we don't talk about is this potential other. We talk about it in the general population, the pandemic of mental health that followed COVID-19, and we don't really talk about it among our incarcerated brothers and sisters, as Commander Figueroa said. So I think that's something, looking into the future, these long-term consequences outside of just infectious disease. So I want to thank each and every one of our panel who came and were honest and thoughtful. And I am so just humbled to be in the presence of you all and just honored to know you. I hope this, is not the end of our conversations, and I really appreciate your time, energy, and effort. Thank you again to all of our CHER people and the ABRC for funding this workshop.
That's the end of our panelists and our panel and workshop, so thank you.
Thank you, Ricky and Carly.
Thank you so much. Thank you, Ricky and Carly, for organizing this.
Thank you.